think about the rates of community transmission, and I think about how likely we are to be exposed, and I then make a judgment based upon that. I have only been indoors in another place a few times since the pandemic started. I think I've been to maybe 3 or 4 stores. On the other hand, I've been strawberry picking loads of times. Strawberry picking is outdoors. It's easy to maintain distancing. You can wear your mask and everything. It's great. And then you get strawberries into the bargain as well. Now, going forward, I would sort of start considering rates of community transmission and being more restrictive. I would certainly not go into a crowded indoor space. There should not be any crowded indoor spaces anywhere right now, because those are places which run the risk of super spreading. And that's something we should all wish to avoid. And since the spring, I've been doing we've been enacting infection control, basically considering that the house is a green zone, anywhere outside is like amber, and then some places where the viruses would be red. And that means, we wash our hands for 20 seconds every time we come into the house. We've stopped changing our clothes recently because we think that community transmission is probably pretty low. Obviously, we're wearing masks and stuff like that. And I don't know if you've noticed, when I get an itch on my face, I try to scratch it with my glasses.
I have noticed.
Try and avoid touching my face. So these are all sort of steps which, behavioral change is hard, so get into it early. But I note these are ways that we are protecting ourselves. And the thing about public health is it's not an individual thing, it's for the public. And what we want to help is we want to take action which can stop other people becoming infected and stop that community transmission, which I've been talking about throughout. Because, chances are, if we became infected, we might be okay, but that's not the point. I don't want to become infected because I don't want to transmit it to somebody else who's less fortunate.